Wonderful. So we're talking about mental health and arthritis today. So we're going to take a little bit of a deeper dive into those links there in terms of how mental health affects arthritis, and arthritis can also affect mental health. So it's a bit of a catch-22 there. I'm just going to let you all know that this presentation contains really general information and advice. We make sure the information we share with you is all evidence-based. If you have any questions that actually relate back to your mental health or your treatment, just always consult your doctor or healthcare provider. But in saying that, we're going to do our best to help you out with any questions that arise through the presentation today. So I mentioned we're going to talk about the catch-22 of mental health and arthritis, but we are exploring themes related to anxiety and depression. So if you find that some of these topics do evoke distressing emotions, I do encourage you to reach out to some of the support services that we will list at the very end, those being Beyond Blue support, Lifeline, and we've got a couple of others that you can be directed to for some assistance. So we're going to talk about some coping strategies and some of those supports services that are available to you. And why don't we start with talking about what actually is mental health? So mental health, it does shape how we think, feel, behave. It kind of influences every aspect of our lives if you think about it. What you're seeing here is the definition of mental health by the World Health Organization. But the thing is, when you're dealing with a chronic condition, some of your everyday challenges can be more pronounced. And so we're going to talk a little bit more about this as we move through the presentation today. I'm sure we can all agree that we experience ups and downs, where some days we're going to be bursting with energy and positivity. We're going to be ready to tackle some of the things on our to-do list. But then you probably have other days where we might feel a bit low, little bit more stressed out about things or anxious about things. But this is all part of being human. And so by accepting these fluctuations, having those coping skills on hand, building that resilience, we're able to actually maintain a sense of balance, a sense of self-worth. And when we're emotionally healthy, we can actually fully engaged with these things. We can engage with our loved ones and our community. When we're talking about living with a chronic condition, it can significantly impact on our mental health. And I'm sure some of you can reflect and think about how it impacts on your mental health. Arthritis is one of those risk factors for anxiety and depression. Other risk factors can include if you have a family history of mental health conditions, if you've experienced stressful life events, personality factors. All these things can trigger anxiety and depression, which can lead to more intense, frequent shifts in moods and emotions. But it's when these fluctuations become really difficult to manage, that's when we start thinking about, how we can support mental health now. So according to recent statistics, depression and anxiety, they do affect a very significant proportion of people living with arthritis. It's said to impact approximately 2 out of every 10 adults who live with arthritis. And so not only can arthritis affect mental health by causing pain, it could be that it's limiting activities that you particularly enjoy doing. It can induce feelings of loneliness or worry about the future, about your condition. But mental health issues like feeling down, anxious, or stressed out can also exacerbate those typical arthritis symptoms. We're talking physical, emotional, mental symptoms. So recent research has looked deeper at this link between anxiety and depression and pain thresholds. And this is what we're going to look at a little bit closer today. Because what they found is that even mild and moderate pain can feel more intense or bothersome for individuals with these mental health conditions. It's a bit of a double-edged sword because chronic pain from arthritis can actually worsen the anxiety and depression, and that's what we mean by a catch-22. So arthritis, I'm sure we all know, can cause a lot of debilitating physical symptoms, but also emotional and mental symptoms. So stress, anxiety, depression, all of these are very common in people living with any kind of chronic condition. But because stress and anxiety can, be perceived as normal, and there are levels of it that are normal, we often don't seek out mental health services or treatments for it. So when they're left unaddressed for very long periods of time, this stress can increase the risk of anxiety, and prolonged anxiety can actually increase the risk of depression. So again, stress and anxious feelings can be a very normal response to a situation where there might be some kind of feeling of being under pressure, or feelings of worries or nervousness or uncertainty. And just to use an example to frame that, if you wake up with stiffness in your joints, reduced function in maybe specific joints, it can be very normal to worry about how your day is going to look. It could bring on feelings of nervousness because your day might look a little bit different than anticipated. But once those feelings of stiffness have actually passed, you've regained your function, you'll notice those feelings have settled. But this is an example of someone bouncing back from adversity and coping with that acute stress and anxiousness. Anxiety is really a lot different to this. So anxiety is more than just feeling stressed or worried. Anxiety is more when your feelings and worries don't actually subside. It's more about when it's ongoing, and it can come on without any particular reason or cause. So it can make it really hard to cope with everyday living, those everyday activities, and those feelings can't be easily controlled. So symptoms of anxiety conditions are sometimes not very obvious because they often develop over time, very slowly, very gradually. But each anxiety condition really has its own features and presentations. Anxiety can manifest physically. So this is where you can see it present with panic attacks, hot and cold flushes, a racing heart, maybe tightening of the chest. There can be psychological symptoms as well, where there is excessive worry, excessive fear, catastrophizing, which is something we spoke about last week. And then there can be behavioral symptoms as well, where it results in the avoidance of situations that make you feel anxious. It could be withdrawing from friends, withdrawing from family, and all these things can impact on study, work, social life, social activities. And so you have your normal anxiety that is more limited in duration, and it's usually connected with some kind of stressful situation. But when we're talking about an anxiety condition, we're talking about its symptoms being a bit more frequent, a bit more persistent, and it's not always connected to an obvious challenge. So this is when it can really impact on things like quality of life and day-to-day functioning. Depression is different again, in that it's more than just a low mood. So depression is a very serious condition that has an impact on both physical and emotional well-being. So we all feel sad, moody, or low from time to time. It could be weeks, it could be months. But people experience these feelings more intensely for a lot longer periods of time. So this could be months, it could be years, and come on without any apparent reason. So depression can affect all things about yourself. It can affect how you feel about yourself. It can make life more difficult to manage from day to day. It could result in you losing interest in your hobbies, social activities, and just doing things that you normally enjoy. You could also have this paired with lack of energy, fatigue, excessive sleeping, feeling anxious, irritable, or finding it hard to concentrate as well. So if you were to notice these symptoms of anxiety or depression, this is where it's really important to actually seek treatment. And this is where healthcare providers can actually help you navigate these challenges. So there is a lack of clarity whether depression is caused by rheumatoid arthritis or the chronic inflammation in rheumatoid arthritis impairs the physiological response to stress, leading to depression, which can worsen long-term outcomes. So the prevalence of depression in people with rheumatoid arthritis actually ranges between 14 to 48%, with major depressive disorders occurring in about 16.8% of people living with rheumatoid arthritis. So that's a huge amount of people who have this condition that also present with mental health conditions like depression. So when we're talking about the connection between pain, disability, and depression in arthritis, there is a developing theory that actually explores the role of inflammation here. So we're talking more about now, the link between arthritis and depression with biological reasons. So there are several factors associated with a high risk of depression, but these are also linked to systemic inflammation. So there's a lot of overlap between these risk factors, and we're talking psychosocial stress, poor diet, lack of physical activity, obesity, smoking, excessive alcohol consumption, vitamin D deficiency as well. And the thing is, with rheumatoid arthritis and osteoarthritis, inflammation actually plays a significant role. And so there is a theory behind it. And this is where I'm going to get a little bit technical here, but not too technical, where we lose ourselves in this. But there's something called cytokines. So cytokines are small proteins that are involved in many biochemical processes in the body. But these are produced during inflammatory processes. So these cytokines are said to have a role in influencing mood. They've been implicated in the development of depression. And research suggests that these cytokines that are produced during inflammation can cross something called the blood-brain barrier. So we're now talking about how we can interact with neurotransmitter systems in the brain. So there is a physiological reason as to why there is such a strong link between mental health and arthritis. So in rheumatoid arthritis and osteoarthritis, if there is a persistent release of pro-inflammatory cytokines, it's suggested that it can actually lead to alterations in brain chemistry, which can contribute to the development of depression. And this is where it's called it's known as cytokine-induced depression. I want to talk to you more about that. So I just want you to imagine when inflammation levels are very elevated in the body, you have different cytokines that can actually interact with our body's nervous system. So they play a crucial role in how we perceive and respond to pain, but their influence actually goes way beyond physical discomfort. So inflammation doesn't just cause physical symptoms. In the context of rheumatoid arthritis and osteoarthritis, chronic inflammation, which is a characteristic of these conditions, can lead to those elevated levels of inflammation and cytokines in the body. So not only can these cytokines, heighten our perception of pain, they can make us more sensitive to discomfort, but this heightened sensitivity can actually exacerbate pain experienced in things like arthritis and cause chemical changes in the brain that can trigger depression and anxiety. So neurotransmitters are basically your chemical messengers in the brain. They communicate all kinds of things in the body, but they regulate mood and emotions. So neurotransmitters, has anyone heard of serotonin, dopamine, glutamate, your happy hormones? I'm sure we've all heard them pop up at some point. But they play key roles in mental well-being as well. So when you,
Sorry to break in, but
yeah,
can you get a blood test to see if that those
cytokine.
cytokines are actually affecting you, or is there no way to tell?
If I'm honest, I don't believe there is a way unless there is some very extensive research that's been developed and they're specifically looking at cytokines, but it's not something that a regular person with a chronic condition can go in and test for. They're part of the inflammatory response pretty much. So
So you
yeah.
can't find out if they're active in influencing how you feel, so to speak.
Oh, actually, I'm just trying to think. I might come back to you on that because there are inflammatory markers that you can see in the body, but I guess, you've heard of your things like CRP, um, and if we're getting a bit more technical, your interleukin-6. They're all inflammatory markers that people look out for when they're measuring inflammation in the body, but I don't think you can just walk into the doctors and say you want to test all your cytokines because there's a lot of different cytokines as well. So we'll circle back to that, Gail. So pretty much, as I was saying with your happy hormones, as I like to call them and just easily refer to, when your cytokines are elevated and they're due to inflammation, your pain is intensified, but that can disrupt the balance of those happy hormones, which not only cause changes in your responses to pain, but alterations in mood and emotional stability. So your serotonin and dopamine are usually the better known happy hormones. They're the ones that contribute to your feelings of pleasure, happiness, they desire, well-being. When these particular hormones are usually disrupted, they can contribute to symptoms of depression and anxiety. And similarly, something called glutamate, it's a neurotransmitter. It's a more excitatory signaling chemical that happens in the brain. But when there's changes in this particular neurotransmitter, it can also affect mood regulation and contribute to symptoms of depression or other mood disorders. So pretty much it's like your neurons are going haywire. And so this does a lot more than just make you feel pain. It changes how you feel emotionally, how you deal with adversity, and also how those chemicals in your brain work. So with rheumatoid arthritis, there's been several studies that have shown depression in rheumatoid arthritis is linked with more than just pain, fatigue, physical limitations, but also difficulties with sticking to treatment plans. So whilst your mental health can actually affect pain tolerance, it can affect behaviors like taking medications, taking them consistently, adhering to the plan by a healthcare provider. It can affect how you communicate any concerns, side effects, changes in symptoms, but it can also affect your health behaviors as well, like following a balanced diet, engaging in regular exercise, managing stress, getting adequate rest, and getting that good quality sleep. So there's been a lot of randomized controlled trials and research trials that have looked at medications and how people respond to them. Medications, particularly your disease-modifying anti-rheumatic drugs, which are your primary treatments for rheumatoid arthritis and other autoimmune types of arthritis. They found that patients with depression were 40% less likely to reach that remission, even though they were taking the drugs to manage their rheumatoid arthritis and that disease activity. They found that people who were struggling with mental health challenges were still experiencing the ongoing pain, as opposed to people who, were able to cope with mental health challenges and didn't present with any. With osteoarthritis, there were about 38 studies, and they discovered that anxiety or depression are very common in people living with osteoarthritis. Some common findings actually suggested that people with OA and also diagnosed with anxiety or depression experienced more frequent hospital visits, took more medications, reported less optimal outcomes, as well as more experiencing more physical limitations. Now, when it comes to surgery for osteoarthritis, now we always say that surgery is an appropriate treatment for the right person at the right time. And so for some people, it can absolutely be a game changer. But for people with anxiety or depression, there's been research that suggests the results might not be as effective, because it can affect the way someone engages in the rehab after the surgery. The hormones involved in that stress response can also interfere with the body's natural healing processes, can lead to delayed wound healing and increased risk of infections. And so there's so many different ways that mental health can actually complicate pain management strategies, which can in turn hinder rehabilitation and impede recovery following surgery. And so what I'm trying to get at here is, this is why it's super, super important for any healthcare provider, your doctor, physio, rheumatologist, to think about your mental health if they're treating your arthritis. And it's really important to be open about it as well. So if we take a look at some of the research that was done back in 2019, there was one study in particular that looked at self-reported data of over 1,400 people who were diagnosed with knee osteoarthritis. The self-report looked at traits of anxiety, depression, catastrophizing, neuropathic like pain, fatigue, sleep disturbances, cognitive impact, and each was associated with pain intensity and clinical and experimental markers for central pain mechanisms. So what they found was that people who had higher amounts of these traits, like high levels of anxiety, depression, catastrophized more, actually reported having more persistent and severe knee pain. So this is where the research suggested it's really important to address those underlying factors influencing pain for that optimal pain management, and that it kind of explains why mental health should be part of that whole person approach if we're looking at long-term management of arthritis. All the behaviors, emotions, all these have some kind of role in helping with those pain outcomes. So managing your mental health, it involves a number of different strategies. So whilst medication can be helpful for some, if it's absolutely necessary, there are many other strategies such as therapy, exercise, mindfulness practices, social support, adopting healthy lifestyle habits. All these things can be very beneficial, and there's data to support that. So by combining these approaches, you can expect to address different aspects of your mental health and well-being and create a comprehensive plan that actually works best for you. Coping strategies for emotional difficulties and mental health can really vary from person to person, and what works for you is going to depend on individual preferences, specific issues being faced. And so what you're seeing here, just some of the very many effective coping strategies that work for improving emotional well-being. So this again is why seeking out support from a mental health professional can be very helpful, because they're there to provide personalized guidance, help develop a tailored plan that helps you cope with your emotional difficulties and improve that mental health. So it's kind of taking that holistic approach in your ongoing pain management. Now, medications is interesting because they're increasingly being used for not just chronic pain management, um, but it's really important that we explore the role they play and what they're used for. So SSRIs, SSNRIs are listed here as an example in the top column. These are often your first line treatments in mental health disorders. So they're usually used to improve cognitive function, reduce anxiety levels, improve function, regulate brain chemicals. But they're increasingly being used to help reduce neuropathic pain and help reduce the production of those chemicals that can actually influence perception of pain. Second line treatments for mental health disorders can include that TCA, your tricyclic antidepressant medication, which are more anti-anxiety mood stabilizers. They're not commonly used these days for mental health. They are older drugs, but they do work to improve a wide variety of anxiety disorders. And there's so many different medications available on the market that are used for anxiety and depression, but sometimes they're actually prescribed for the analgesic effect on chronic pain. And this is just because there is now a stronger recognition for how mental health and pain intersect with one another. So it is important to note that the effectiveness of medication for mental health and for pain can vary from person to person. Not everyone is going to get the same kind of effects from them, so not the same kind of pain relief or the response to those medications. It could take time for some, but just like any medication, their benefits, risks, side effects all need to be weighed up. It's really important their safety profiles are considered, and there is a very formal decision-making process that goes on between you and your doctor if you're looking at taking medication for mental health. Lifestyle modifications are very well known to have a profound impact on things like those neurotransmitters I was talking about before, inflammation, the stress response, all of which play very critical roles in mental health. So there have been many studies that have looked at lifestyle factors like diet, exercise, sleep, and how they work on neurotransmitter production and activity. So for example, they've found that regular exercise increases serotonin levels, and I'm sure you guys have heard that before. There's a reason as to why there's a lot of hype behind increasing exercise for helping with things like pain, but also helping boost those happy hormones. You have foods which are very rich in amino acids, and they're pretty much the building blocks of some of those happy hormones as well. There are certain lifestyle habits, such as engaging in cognitive activities, learning new skills, practicing mindfulness, meditation. All of these can enhance something called neuroplasticity, so the rewiring of the brain and how your brain responds to stress and produces those happy hormones. These activities are suggested to promote the growth of new neurons, strengthen existing neural connections, all which are very important for building that mental health resilience and that cognitive function. So healthy habits, balancing your diet, regular exercise, stress management techniques, getting enough good quality sleep, all of these are super important for not just brain health, but reducing that risk of mental health disorders. So there's good reason as to why they're usually in that toolkit for managing mental health challenges. So we've spoken about challenges of mental health. Let's talk about the power of mindfulness. And so we've discussed how our brains are very much involved in pain perception. But have you ever wondered if our brains can also create pain relief? So this is where mindfulness actually comes into the conversation. And so it's a very powerful tool that absolutely deserves a place in your pain management toolkit. Research has consistently shown us that mindfulness can effectively manage anxiety and depression, and especially when it's linked back to conditions like arthritis. So, studies have found that mindfulness based interventions can improve psychological distress, depressive symptoms, self efficacy, well being, pain intensity, can enhance coping abilities, maybe even have a role in improving disease activity that we often see fluctuate in conditions like rheumatoid arthritis, maybe even gout. So these interventions are often recommended alongside traditional disease management approaches. You're seeing more and more practitioners becoming stronger advocates for this method and this strategy. And mindfulness not only helps regulate emotions, but it's there to help reduce that psychosocial stress that comes with having a condition like arthritis. So a lot of the research, they show very promising results, suggesting it's crucial for not just managing the condition, but addressing that anxiety and depression that can coexist with those conditions. And so if we look at some of the research behind it, there was one randomized controlled trial that involved 337 patients. So I would say that's a good amount of people who practice mindfulness for their chronic, when they were living with arthritis. They actually reported experiencing greater improvements in pain intensity compared to their control groups. So that was very interesting finding. So when we're talking about mindfulness, some people can imagine themselves sitting in silence, maybe outside or by the beach, or grounding themselves in nature. But there's a lot of ways mindfulness can actually be practiced. Sometimes it's just about recognizing what exactly is driving a stress response that is maybe causing anxiety or linked with your depression. And it's about reframing your logic around it. So an example of what mindfulness might look like in practice is actually encapsulated in this diagram you see here. So this flowchart, it illustrates what happens when we are not mindful. So the comments in quotations are what should be practiced, and it's all about being aware, being present, and accepting what is happening. So learning to recognize the stress response, it's really important for improving well-being, improving our performance. The idea is that it helps us catch the stress response a lot more quickly by noticing it in how it's manifesting physically. So are we noticing it in our breath or our body sensations or our mind? And then actually recognizing it's a stress response. So once we've actually done the analysis on ourselves, we've noticed our breath is picking up, maybe we're noticing pain or stiffness come on, it's about maybe asking ourselves, what could it be that's driving this? Or what's happening in our mind? What's our attention caught up in and driving that response? Once we've done that, we can actually start to practice redirecting the attention back to the presence. So when we don't notice stress reactions, when we're unconscious, there is a part of the brain that's just firing and experiencing things as a threat, simultaneously releasing hormones that are meant to help us adapt to the stressor. So the mind is becoming very agitated as the body and mind prepare themselves for action. So that's a stress response. And I guess this is why we always start with the breath. And you'll notice that a lot of breathing techniques are very much integrated into the practice of mindfulness. One of the biggest telltale physiological signs of a stress response or anxiety is going to be attuned to the breath. And you might notice subtle changes or significant changes. But if we can change our breathing, then we can recognize then, okay, I'm having a stress response. If we don't notice changes in the breathing, which often we don't, there's a part of the brain that continues to fire. At its worst, it can actually escalate into a full-blown panic attack. But this is why it's really important to catch that breath first. So as soon as we're becoming more aware that we're having a stress reaction, or if we're having an anxiety attack, we can immediately disconnect from it by just pausing and checking in on our mind. What is our attention caught up in? So it's guaranteed it won't be focused non-judgmentally on what's in front of us. It could be that you're worrying about something from in the future. It could be dwelling on something in the past, or judging something, or judging ourselves. Maybe we're caught up in a little bit of self-criticism. But if we're able to actually identify and notice this is what gives us the power to redirect our attention back to the present. So these are just some examples of what we can actually practice instead. So if you notice your breathing has increased, if we take a minute to recognize, okay, it is a stress response. Maybe if you're catastrophizing, think about what our attention is actually caught up in. And so you can either redirect your attention to an activity, or you can really tune in with your breath and just focus on the present task. So we can take note of our thoughts. And then, of course, this takes practice. It takes a lot of patience, but eventually getting to a point where you can challenge those negative thoughts or those stresses and or accept them. And so instead of negatively labeling it or triggering the stress response, acknowledge what's going on, accept it, and let it go. So this is where it becomes a practice of trying to break a pattern of negative thinking, which is what can actually drive the stress and make pain worse. So tips for improving mental health for arthritis: you can absolutely speak up. Sharing your feelings with your healthcare provider, or even a family member, a close friend, a partner, can be really important, and it can be very helpful to share your feelings, your experiences, and then you're also allowing the person to help provide appropriate support, guidance, and treatment. Finding a support group or speaking with a mental health professional. So seeking support from peers who understand your experiences, or consulting with mental health professionals, can offer invaluable assistance here. So support groups can really give you that sense of community and understanding, but mental health professionals can actually give you that expert guidance, that therapy, and work on a treatment plan to address your specific challenges. So it's a bit more individualized. Prioritizing self-care. I'm sure you've heard this one before, but self-care, it does involve consciously engaging in activities that promote your physical, emotional, and mental well-being. Can include hobbies that you enjoy, spending time with supportive friends. If you think of something that you enjoy doing, is it gardening, cooking, maybe crochet? Prioritizing self-care can really help reduce stress, increase resilience, but overall improve that mood. Getting adequate sleep. I know this one can be challenging when you live with arthritis and you get the hip pain and stiffness at nighttime, wakes you up. But sleep, it plays such a crucial role in mental health and overall well-being. The guidelines suggest about 7 to 8 hours of quality sleep each night, but if you're not getting that, it could be a good sign that maybe you need to speak to your healthcare provider to look at ways you can improve this. Consistent restorative sleep is absolutely essential to mental health, because we know that insufficient sleep can not only exacerbate stress, can exacerbate anxiety and depression. And then, of course, spending time outdoors or moving regularly. I mentioned before that there is a good reason why we talk a lot about increasing exercise, not just for the benefits of keeping your joint tissues nice and healthy, but exercise releases so many endorphins and hormones that actually help with increasing happiness and reducing that pain perception. So whether it's going for a walk, practicing yoga, engaging in Tai Chi, incorporating these slowly into your daily routine have a very powerful impact on mood and mental health. If you're ever wondering about what it looks like or what the process involves, when you want to seek out some mental health support from your GP is a really good starting point, a really good initial point of contact if you know this needs to be addressed. So when you go see a GP, they will conduct a diagnosis. They'll assess any underlying physical health issues or medications that you could be taking that influences how you're feeling, how you're managing your condition. They will offer information, collaborate with you to establish a mental health treatment plan. And I guess they can provide support, but often they will make referrals to mental health specialists. And I guess there will be some eligibility for Medicare rebates if you are suitable. So some of those support services I mentioned right at the very beginning of the presentation included Lifeline, Beyond Blue, there is the Black Dog Institute, and Mind. So these are all hotlines that you can call up if you are struggling with your mental health and you recognize some of those symptoms are having an impact on your quality of life. They can give you that individual support. They have programs available online. So they're definitely contact numbers worth saving. Oh. And if you feel like you're not ready to go to the GP or not comfortable with it, there are so many online therapies for anxiety, and e-therapies, psychological therapies, which can be equally as effective as face-to-face services. Their services might involve you talking to them directly over the phone. It could be by email, text, or instant messaging. So you can find a whole different variety of online therapies if you were to go to the Australian government's Head to Health website. So you might see a page called This Way Up, and it's a cognitive behavioral therapy program for chronic pain, but also programs for mental health, which can be very beneficial. And just some nice quotes to finish this session off with. Mental health problems don't define who you are. They are something you experience. It's just like when you walk in the rain and you feel the rain, but you are not the rain. And so self-care is how you take your power back. Now, so that brings us to the end of the session. What I might do is I might pause the recording here